Hey, what's up? This is Kelly. Today is Wednesday, March 30th, 2016, and I just had my gastroenterology appointment to set up an endoscopy pre-surgically for my gastric sleeve procedure, which is scheduled for June 22nd, 2016. So I also just heard from my sleep study, and I do have sleep apnea, so it looks like that will definitely approve me for the surgery, so I'm happy about that. So yay! My endoscopy is scheduled for April 27th, so that's like a month away from now, and then the surgery itself is 2 months after that. 2 months after that. So everything is in line. The only other appointment that I need is with the actual pulmonologist. Now that I have sleep apnea, I need to see the pulmonologist and get a CPAP machine for that. And they also do a pulmonary function test. And I have to see the nutritionist, which is April 20th. So everything's in line, and I'm really excited. And oh, also I told my family about the procedure. I had told my two best friends last week and the week before about the procedure, and they were both so super supportive of me, and I'm so grateful to them. They don't even know how much it means to me that they were like, right off the bat, they were like, yeah, go for it, go ahead and do it, take care of business. My two sisters, on the other hand, were incredibly not supportive. My one sister made a comment, oh, I've seen you eat, I know how much you like food. Yeah, who doesn't like to eat? I mean, you know, everybody likes to eat. So, I don't know, it was just kind of an ignorant comment. And my other sister thinks I'm being ridiculous. In her words, I'm being ridiculous. She seems to think that I can just lose weight by dieting and exercising. However, she herself is morbidly obese and has metabolic syndrome and mitral valve prolapse and heart disease and all other kinds of, you know, things wrong with her that she should really be having the procedure even before I should. So it just goes to show how ignorant some people can be. But I'm really excited. My parents, surprisingly, I thought they were going to be a little more like nervous about it, but they kind of didn't say anything negative. Their concerns were more like, you know, what does the procedure entail? What actually happens during the procedure? How much of my anatomy is going to be changed? What the recuperation period is like? How long I would have to stay in the hospital for? Things like that. They weren't really concerned about the procedure itself, other than, you know, the fact that I'd be having surgery, but they weren't negative about it at all. They didn't specifically say that they were happy for me to have the procedure, but they didn't try to dissuade me in any way. They were just sort of asking more questions and gathering information. So I was really happy about that, because I was kind of concerned that they would also kind of jump on my back about it and give me a hard time, but they didn't, and I was surprised and pleasantly surprised at that. So everything is moving along slowly and smoothly and surely, and I'm getting really excited. So the good thing is that because I have the sleep apnea, I can drop down to a BMI of 35 from, I think I weighed in at like a BMI of like 41. So I can drop down to 35, which is great because I feel awful at this weight. I really need to drop down some. I'm just so uncomfortable in my skin. I feel short of breath just walking around normally. None of my clothes fit me, and I feel like, you can see in here, this drives me crazy. I don't like any of this. Even like this part of my face is very full. It's just really uncomfortable for me. I feel like everything is rubbing up against each other, and it doesn't feel good. And I'll just feel better if I can lose some weight. So my goal is to drop down to at least a BMI of 35, 36 before my procedure. And considering I have about 3 months to do it, I don't see why I couldn't do that. That would be losing about 20 pounds or so, and I could easily do that, you know, with diet and exercise and utilizing the HCG. That's what really helps me to lose the weight. And then I'll have to come off of the HCG about you know, they say about 14 days before your procedure, so maybe I'll do like 3 weeks before, just to be on the safe side. Although I did order some pregnancy tests just so I could, you know, monitor. I'll do a baseline for a baseline reading, and then I'll check it like every 2 weeks or so to see if it's even registering on the pregnancy test. The dosage of HCG that I take for weight loss is very, very low. Some people say that it doesn't even register. Other people say that it does show up. So I guess it just depends on the sensitivity of the test. But being a nurse, I know that in the hospital, preoperatively, we use just a urine pregnancy test. So if I'm testing with, you know, a home pregnancy test at home, then that would be significant. You know, if I had a baseline of a negative and then somewhere along it changed to positive, then I would know that, you know, when it drops back down to negative, that it's completely out of my system and I won't have any problems when I get to the hospital for my procedure. Because I would hate to have to show up that day and have them do a pregnancy test and say, oh, you're pregnant, we can't do this test. And a lot of people don't understand that when you are on HCG, it can have a false positive. You would have to do a quantitative and a qualitative. So most of these tests are qualitative tests. So it, you know, home pregnancy tests for the presence of the HCG hormone in your bloodstream, or rather in your fat cells, your urine, whatever. And HCG like doubles every few days when you're pregnant. So until it reaches like you know, the highest level that it might be at, which might be, say, 50,000. Whereas, you know, in the very early stages of a pregnancy, it might only be 5,000. So by doing a qualitative test, you're just checking for the presence. It could be 2,000, it could be 5,000, it could be 10,000, it could be 50,000 already. It doesn't tell you how much HCG is there. By doing a quantitative, you do it in a succession. So you would do blood tests, which are much more specific, and you would test on 2 to 3 separate occasions. And what you would be doing is you would be checking to see if those amounts change. So if you take the first test and it comes out 10,000, and you take the second test and it comes out 12,000, and you take the next test and it comes out 50,000, then yes, I'm definitely pregnant, because those numbers are growing in succession, you know, every time that you take it, which would mean that I would be pregnant. But if I'm on HCG and I'm taking the exact same dosage of HCG every day and that doesn't change, and my test readings come back 12,000, 12,000, and 12,000, or within that very close range, that would not be significant for a pregnancy. That would mean that I'm on a medication, and that as soon as I would stop the medication, those numbers would fall off. So likewise, if I were to stop 2 weeks before and get my pre-admission testing, and they did a quantitative amount of HCG at that time, say it read at, you know, 20,000, and then the day of my procedure they did another quantitative test and that came back at, you know, 4,000 or 2,000, that would mean that I had stopped taking the medication and it's almost out of my system, and that I'm clearly not pregnant. So that's something to consider. I don't want to even have to go that route. The worst case scenario is that they would make me do a transvaginal ultrasound probably on the day of the procedure, or have to delay my procedure in order to have that done, and I don't want to go through that. So to be on the safe side, I'll stop it 2 to 3 weeks beforehand, and I'll just do a home pregnancy test, baseline, and maybe partially throughout, and then at the end to see if anything even shows up. If it's not even showing up, then it may not even be worth worrying about. But just to be on the safe side, I don't want to run into any problems, I will stop it 2 weeks before. So there we are with that. And I guess I'll check in again after my pulmonology evaluation or my nutrition evaluation, and as things come up in my journey. So like my video and subscribe and make any comments down below. I'd love to have some other people who are also on this journey, whether they've already had their procedures or they're going to be having procedures.